We are going to start with issue 1, which is through the lens of anosognosia, HR 1, and the future of behavioral health services. And if you don't know what anosognosia is, you're going to learn a lot during this issue and during this panel. I would say it's one of the more important or most important things for us to discuss when it comes to hard-to-treat mental illness. And this is an issue of personal importance for me over the past few years that I've been in office. I've heard from multiple families that I represent whose loved ones are living with hard-to-treat mental illness. One of those is anosognosia, and it's a neurological condition that prevents individuals from recognizing that they are sick, prevents people from recognizing that they have mental illness, which makes this exceedingly challenging to get treatment. And I've heard from families directly, some of whom you'll hear from today. Their stories are both humbling as well as clarifying, and they've shown in very real human terms the heartbreaking story of how California's behavioral health system has many gaps that we need to address. And they'll also talk about the cost of our mental health system reaching its limits and not serving every person that our system is meant to serve. The share of California adults with serious mental illness increased by approximately 50% from 2008 to 2019, with young adults seeing that share nearly double over the same period. So we know this is serious in California. And more than 1 in 5 California adults has a mental illness, with less than 80% of them receiving treatment. So there's a significant portion of the population who have yet to receive treatment. As you all know, and as this committee knows, these figures represent real people who have been cycling through emergency departments, psychiatric holds, jails, crisis settings, care courts, and other kinds of programming without being able to achieve lasting change. And while California has made significant investments in behavioral health in recent years, we definitely need to continue. But what we're facing right now with HR 1 is going to take us backwards. Because of the significant reduction in Medi-Cal dollars, we know that funding to counties is not going to come in the way that we have become accustomed to, and frankly, in the way that our communities need it to. And we know that providers are not going to be able to provide the same level of service because of HR 1. So today, this subcommittee has invited families impacted by anosognosia to share their experience, and a number of county and provider experts are also here to help put those experiences in a broader context and talk about both what's working and what's challenging and what we need to be doing from a budget perspective.